I am New York.
Я сам Нью-Йорк.
I am New York.
Yo soy Nueva York.
Sono New York.
Je suis New York.
We are New York.
Welcome to Diverse City, where we explore New York's eclectic enclaves, one neighborhood at a time. I'm Zyphus LeBron. This month, we're heading to Port Richmond and neighboring West New Brighton on Staten Island's more diverse North Shore. Once an independent village, Port Richmond is one of the island's oldest neighborhoods. It's bordered to the north by the Kilvan-Cull Waterway that was once a major port of economic prosperity for the area. The neighborhood is majority middle-class white, with a significant Hispanic, particularly Puerto Rican and Mexican population, followed by African Americans. The area's got some connections to American history that stretch all the way to the White House. Lately, the district is developing a dubious reputation for shootings. On this episode, true to life, former felons now on the right side of the law push back against increased incidents of gun violence. Port Richmond strong, tensions brew over competing visions for the future of a once vibrant thoroughfare. And bring back the boats, the effort to return the area's maritime industry to its heyday. Those stories and more coming up as we explore Port Richmond and West New Brighton on Staten Island. The grassroots organization True to Life is employing former felons as part of a public health approach to addressing the increasing number of shooting deaths in Port Richmond and surrounding areas. I found out a little more about the cure violence method, its efficacy, and why there's still some resistance to it.
Say stop the gun violence. Stop the gun violence. I said stop the gun violence.
The man with the megaphone is Malcolm White. He is a credible messenger with an anti-gun violence organization in Port Richmond called True to Life. The organization is part of the New York City crisis management system. They see shootings as a public health issue.
The cure to that disease is to help change mindsets. And the first part of changing mindsets is to interrupt a situation. So how that interruption happens is if two individuals are having some type of conflict and we know one side or both sides of the parties, all we need to do is know one side of the party, have an in-way with one side of the party. We can then go in and mediate the situation.
After nearly 2 years of relative quiet, White and the rest of the 12-person True to Life team have been dealing with a spike in brazen killings that's caught the attention of local politicians.
We're standing here on the corner where a young man in our community was killed in broad daylight. Less than 48 hours, 3 young men have died as a result of gun violence in our neighborhood. Shootings in Staten Island are up by 110% this year compared to 2019.
That's a higher percentage than the 76% increase the NYPD reports for the city as a whole. What it means in real numbers is that the 121st Precinct has reported 15 shooting victims through November 1st of this year, compared to 6 for the same period last year. Though crime statistics do traditionally spike during the warmer months, Felix Polanco has another idea as to what's caused the higher numbers.
90% of the time when we get into the hospital, we're able to prevent a retaliation from occurring and leaking outside of the hospital. So as a result of COVID, we weren't allowed to go inside of the hospital. And then we saw a spike in Staten Island. We started seeing numbers that we haven't seen in a long time.
Polanco is also a violence interrupter with True to Life. A lot of his work is done in the halls of Richmond University Medical Center, or RUMC, which sees the majority of gunshot victims on Staten Island.
Richmond University Medical Center sees about 85 to 90% of all the penetrating trauma on Staten Island. So having a resource like this and having these hospital responders who either have experienced this type of violent act in the past, that have an understanding of it, not just from the clinical side that we can take care of, but from the mental aspect side.
The cure violence method of dealing with shootings is not new. It was actually developed by Dr. Gary Slutkin, an epidemiologist and professor at the University of Illinois at Chicago back in 1995. It's been implemented by different groups around the country in gun violence-ravaged areas in New Orleans and Chicago. But experts like John Jay's Dr. Jeffrey Butts say it's hard to prove the efficacy of this cure violence method.
It's a challenge to have something that produces a meaningful effect, but it may not be statistically significant. And because of that, these community-based programs tend to lose out to policing and therapeutic programs, and just because of the nature of evaluation research. And that is a challenge for this model, for this public health model.
Dr. Butts also says that the notion of a credible messenger is frightening to donors, police, and legislators who may not trust or find it too expensive to pay and train former felons like Polanco and White. White served 2 jail terms, one for armed robbery and the other on drug charges.
I have experiences from going to prison that I could share with these young brothers that can help them to maybe not go to prison. Maybe it was in my destiny to go to prison. So I could let the young brother know that, yo, that's not where you want to be. You want me to tell you what they're doing in there? Because I could tell you, I've been there.
Polanco, who served time for drug dealing, admits that he initially had to get over his trauma with the NYPD. He says they now have a good working relationship.
It was an uphill battle. But right now, I feel like we're in a good space. And now our relationship with them is that if we need statistical data of where, the violence is spiking, or, where the violence is just like out of control, we can get on the phone with the Mayor's Office of Criminal Justice and get the data from them, so we know how to position our staff to try to prevent anything from, increasing.
During a recent meeting at police headquarters, NYPD Chief of Department Terrence Monahan talked about the need to work ever closer with such groups. Dr. Butts says that this sort of relationship is key to addressing gun violence at a time when lawmakers are looking for alternatives to conventional policing. The issue has been more prevalent since the social uprising of this last spring brought on by George Floyd's death and the subsequent calls to defund the police.
I think there is greater receptivity right now to alternatives to the public health approach, but it is a struggle to get funded. In New York City, I've heard people in the city government wonder, is it really wise for us to be spending over $10 million a year on these programs, these credible messengers, these neighborhood-based? And I think 10 million, you spend almost $6 billion on NYPD. Now, a lot of that I'm sure is perfectly justified, but when you're going to be comparing the level of investment, isn't it worth it to maybe one day not have to spend $6 billion on policing because you built these strong communities with these neighborhood-based organizations that can protect public safety far more effectively and cheaper?
That's our look at Port Richmond and West New Brighton on Staten Island. Join us next month when we'll take a look back at 2020. Till then, thanks for joining us as we explore our diverse city.